3 steps for understanding and dealing with your anxiety. I'm Dr. Dan Kessler. I'm a clinical psychologist. So the first question I always want to ask is this thing that I'm anxious about, or you're anxious about, is this thing a thing? Are you fearful of something that just isn't rational or isn't going to happen? I'm terrified of a bridge collapsing. Now, maybe that isn't the best example because we had one happen here in Minnesota. But by and large, if you're terrified about the bridge collapsing, it's probably not a thing. And you're going to want to deal with that by pushing back on that thought. You know what? This bridge is safe. It's exceedingly unlikely to collapse, and unlikely safe. But let's say there actually is some level of danger. In those situations, the first question is this thing a thing? There's reason to be worried about this. Layoffs are coming in the workplace, but you got a big exam coming up you're worried about. Yeah, I have reason to be worried about it. Now the question is, how worried is rational? Is this an 8 out of 10? Okay, fine. But maybe this is a 3 out of 10 anxiety and you're feeling a 7 or 8 out of a 10, in which case you're going to say, yeah, this is a thing. I've got reason to be anxious, but not to the degree I am. And reasonably, rationally, my level of anxiety should be here, and this is what I'm going to do to combat it. And that's what you work with your therapist on. Finally, sometimes it is a thing, and the severity is accurate, and then the question is, how do I cope with that in the moment? This anxiety is about a thing that's a thing. The severity of my anxiety fits with the situation. Now we work on developing coping skills, because we're not going to say that it's not a thing if it is, and we're not going to say that you shouldn't feel that anxious if it's reasonable to. What are your thoughts? How do you cope with those really challenging, anxiety-provoking situations? Let me know.